Hi guys, it's Dave. Today we're going to go over a condition that is not very common. However, if you do have it, it's very painful, and that is gout. Gout generally occurs in one or just a few joints. They become red, inflamed, and very painful, even to the touch. And moving that joint also becomes very painful. What happens is uric acid builds up inside the joint. And uric acid is a very sharp crystal, and it causes irritation, which causes the inflammation or the swelling, which then of course leads to the pain. What can you do about it? Well, number one, it mainly occurs in older people. In men, the main age is 40 to 60 years old. In women, it's over the age of 60. Nothing you can do about age, but you can exercise. You can decrease your weight because being overweight makes you more prone to gout. You can increase your water consumption. That will help. Then you need to watch some of the things in your diet. Alcohol can trigger a gout flare, especially beer. Dried beans and edibles are definitely an issue with gout, as well as tomatoes. So if you deal with pizza and you have tomato paste or hot sauce or chili or things like that, that can induce a gout attack. Red meat, and especially organ meat, so the liver. If you enjoy liver, but you're a gout patient, stay away from it as much as you can. And then shellfish is another big one that can cause a gout attack. Once you find your triggers, avoid them as much as possible in those foods, and as well as alcohol. Like I said, beer will do it more than wine, but for you, wine may trigger it just as bad. If you get a gout attack, or a flare-up as it's called, like I said, the joint will become red, it can be hot, and very painful. What should you do? Over the counter, you can treat it with an NSAID, like Aleve or naproxen, or ibuprofen. But remember, if you're a heart patient, if you have issues with your liver, if you're on anticoagulants like Eliquis, Xarelto, Pradaxa, Coumadin, or warfarin, you want to avoid doing that without consulting your doctor first. There are prescription treatments out there that can help you out. If you continue to get gout attacks, you can be put on a drug such as probenecid or allopurinol on a daily basis to help prevent the flare-ups from happening. Another drug that's out there that's newer is febuxostat or Uloric. It's again a once-a-day drug. However, it does have a black box warning, which means there are some very significant adverse reactions and side effects that can happen to you, so you definitely want to speak to your provider about that drug. Some medications can also make you more prone to a gout flare-up. If you're on a daily aspirin or using aspirin for pain, which I generally don't recommend, that can make you more prone to a gout flare-up. Niacin over the counter can make you prone to a gout flare-up. So if you're taking those things over the counter, I would consider something else other than the niacin and have a discussion with your provider if you're taking the aspirin per your provider's request. There are some prescription medications that can also do it. However, they are very important, and I don't suggest you coming off of those. For a short-term flare-up, something else that you can do is a prescription drug called colchicine or Colchris. It wouldn't be a bad idea if you continue to have flare-ups to actually get a prescription for that medication to have on hand. One of the problems with colchicine is it can cause nausea and diarrhea. It is important for you to finish the course to really knock that gout attack out. So try and do as best you can. If you can't, again, let your provider know. With all of the gout medications, it's very important that you do take it with a lot of water and continue to stay hydrated. And that also will help to dilute those crystals and get them out of your system.